Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Lynch syndrome and its types. So this Lynch syndrome, there is two varieties. One is type 1 syndrome. So this type 1 syndrome is characterized by cancer. So there's cancer in the proximal colon. So it is in the proximal colon and it is occurring at a relatively young age. So this is present in the young age. Next we move on to the type 2. So this type 2 of the syndrome, so it is characterized by the families at risk for both. So it is in the families. So families which are at risk for both the colorectal. So families are at risk at the colorectal as well as the extracolic. So colorectal as well as the extracolic. So colorectal and the extracolic cancers, and it includes the endometrial. So it includes the endometrial as well as the ovarian, gastric, small intestine, pancreatic, the urethral as well as the renal pelvic origin. Now let's recap. So we saw the Lynch syndromes. So under the Lynch syndrome, the type 1, it included the cancer of the proximal colon, and this is present at a very young age. Second one is the Lynch syndrome. It has a family. It is characterized by families which have a very high risk of the colorectal as well as the extracolic cancers. So what does it include? It includes the endometrial, the ovarian, the gastric, the small intestine, the pancreatic, the urethral as well as the renal pelvic origin. To learn and grow daily like this, please do subscribe.